and it's all about the looming doctors' strike and the issues of devolution of health services as one of those key tenets of this new dispensation we find ourselves in. The doctors have said they will go on strike starting next week if they do not receive their July salaries. Just who is supposed to pay them their salaries? Is it the county government or the national government? We will be discussing this, and that's why we're asking you our question of the day today. We're asking you, do you support the doctors' strike? Do you support the doctor's strike? The numbers to get in touch with me are 8040. That's our SMS line. So do send us a text on that. Please do leave us your name and your location. You can also send us your tweets regarding this at KTN Kenya, at Yvonne Okwara. We will not just be discussing the strike, but the wider matters of devolution of health services around the 47 counties that we now have in existence in the country. And with me now is Dr. Victor Ngani, who's the chair of the Doctors Union. That's the Kenya Medical Practitioners, Pharmacists and Dentists Union.
You got it right.
Finally, we got that one right. Thank you for making the time.
Yes, thank you.
So, let's talk about it. What's going on with your salaries? You haven't received your salaries to date. Why is that?
Well, the first thing, this is not going to be a strike. Doctors from all over the country will come and look for their July salaries if they won't have been paid by the 5th of this month. And the reason for the delay, normally doctors are paid by the 22nd, is because there has been an attempt to hurriedly transfer the salaries of health workers to the counties. Yet the counties don't have structures. And we've been saying this for the last 3 months, and we have been urging the Transitional Authority and other bodies responsible for devolution that, look, healthcare, let us do it stepwise. There are certain areas that can be devolved immediately, but if you attempt to devolve salaries without structures in the counties, then you expect to see salary delays. Now, even before we had finished saying what you are saying, we see July already, there are no salaries in the bank, and today is the last day of July. So if this continues, if this hurried process of devolution, especially of salaries, is maintained, then doctors will have to come and seek answers on the 3rd. You cannot work without pay. Rents are due, standing orders are due, your children need to be paid, your mama mbogas need to be paid. I think this is what we've been warning against, and we hope will be listened to.
Okay. Yeah. So, it's not just about salaries, really, but before we even move away from the salaries issue, so are all doctors now going to be paid by the county governments based on where they are located? Are there some who will be paid by the national government, who would assume those at the Kenyatta National Hospital will be paid by? Just let us understand how they intend to deal with this issue of devolved salaries.
That is the big question that is not easy to answer, because all these answers should be present in the Health Act. As we speak now, the Health Act has not been enacted. The bill is still being redrafted. The bill does not exist, and therefore it's difficult to say which hospitals are county health facilities and which hospitals are national health facilities. And this will help identify who is under the county and who is under the national government. As it stands now, some commissioners just decided that we will become the health bill and we will decide that these are the county hospitals. While they do this, they have not consulted any single health worker. I know the nurses are represented by the Kenya National Union of Nurses. The clinical officers are represented by the Union of Clinical Officers. We represent the doctors. I know none of these trade unions have been consulted specifically on this issue of devolution. So we end up with a bit of a crisis that isn't clear. But that said, we want to specifically say that as our union, we support devolution, and we appreciate the benefits of this, because if you give the counties the money to develop their own hospitals, they know better whether they want to put a hospital at Rongo Center or they want to put at Munyanya Center. They know best, because this is something that they have to deal with progressively. At the same time, issues of procurement, they can procure their own equipment, in fact to some degree even some of the medicines. But what we are saying at this stage, the issue of health workers' pay, that is a big issue that doesn't add value to the counties by just transferring it there, but at the same time it gives this big challenge that needs to be addressed. The counties are not ready for it.
Okay, some would say, Dr. Ngani, that this is too soon to be able to start raising the flag over receiving your salaries, and we do understand the commitments, but some would say, well, you expect your salaries on the 22nd, today is the 31st. people are going to be suffering while, as you say, the doctors will come to Nairobi to find out what's going on with their salaries, should that not come by a certain date?
Well, I think we need to, generally we need to appreciate processes a bit more. You know, if you just wait for your salary at the end of the day, you don't realize someone was working on it for some days before the month ended, it becomes a challenge. And the process for public servants generally, the payroll is run by a certain date, and that payroll is run by around the 20th. Now, it may take a couple of days before that money is released. But as we speak today, the payroll for the health workers has not been run. It has not been run, not because the ministry is not ready, but because people are saying, you cannot run that payroll. Let the counties go and run it. And while they say this, the counties don't have the payrolls themselves.
Right.
At the same time, the question of the devolution itself, even if all the health workers were to be devolved today, the Constitution says specifically that all health workers who will have been taken to the counties under the issue of devolution, they will be seconded to those counties. Secondment means that you'll be paid by the central government, but you will work in those counties.
Right.
And we don't have an issue with that. The problem is somehow someone wants to use certain loopholes and powers they may not have to insist that the salary must come from the county. And that's creating the challenge we're seeing today. There is no magic about it. If were it not for this planned hurried devolution, the salaries for the health workers would have been in the banks a lot earlier.
Okay, so are you worried that if the systems are not in place, it may not just be a case of a missed salary in July, but it may go on to other months?
Even if you have been living in this country for the last couple of years, we know what's going to happen. Some counties will be very effective, others will not be effective. As we speak, Mombasa County workers have been on strike. They're demanding their pay. The other month, Nairobi County workers were looking for we want to have doctors and nurses join this periodic strikes. Now we'll be having a strike every month by health workers. These are some of the challenges that you're trying to raise. We are raising the red flag about it. Unfortunately, for some reason, I think if you are not a politician in this country, nobody listens to you. And that's the most unfortunate thing that we have to change. The question of health sector, we have been advocates for the health sector for the last 2 years. We have said these are the steps we need to take. We have said we support devolution to this extent. This is what we need to do in the health sector. But nobody wants to listen. People have all these utopian kinds of ideas of how you're going to implement these things. We say generally that the laws are good, but the implementation is what is a problem. And we say this for very many things. Healthcare is one of those things. We have devolution, which is a good thing. But the implementers right now want to rush the process, don't want to follow due course, and as a result, they're creating chaos. The chaos on the issue of doctor salaries should not even be something that's happening. It doesn't add value, unless you're saying that doctors will not leave the county because they're paid centrally. It doesn't add value by giving the counties the responsibility of channeling the money to the doctors, because all that money should come to the county, then they pay the doctors if that is what they're calling for. What difference does it make if that money came directly from central government, as long as those doctors are still working in the counties? And it's not clear to us why this is not understood.
Okay. Yeah. Let's talk about the devolution of health services now, and not just particularly, you know, the doctors and working in secondment and their salaries.
Absolutely.
What would that entail? Do you believe that all the 47 counties have the structure, the capacity? Do they have fully fledged hospitals that are well equipped enough to say that in this county, we have, in Machakos County, we've got a hospital. In Nairobi County, we have the same. In Wajir County, we have the same. Do you believe that there is enough of that in every county? Let's talk about what will be devolved, besides just the doctors themselves.
You know, one of the things that I mentioned here about 2 months ago when you invited me, I mentioned that the counties need to be very careful about inheriting huge liabilities. The responsibility for healthcare will not be lumped on the governors. Meaning if they don't deliver, they'll be held directly accountable by the people whom they represent. And we had mentioned that in last year, January, we had worked out a formula to improve healthcare. The budget was 247 billion over the next 3 years towards healthcare to try and improve and ensure that each and every county has a capacity to deliver healthcare. Now, if the governors want to insist that they want to take up all these responsibilities without that funding, then they're inheriting liabilities. And you've mentioned this. Now, there are big discrepancies and big differences between counties in terms of healthcare provision. Generally, any hospital that is not at the level of a level 5 hospital, and there are only 13 of them in the entire country, does not have any services worth really talking of as a county health facility. Now, the level 5 hospitals themselves, These have been regional hospitals serving big areas. I'm talking about hospitals like Kisumu Provincial General Hospital, Kisii Level 5 Hospital, Machakos District Hospital. Now, these hospitals cover huge regions. Currently, without the health bill, some commissioners have decided that this now become county hospitals. That brings about two big challenges. One, the county of Kisii, for example, will now have to contend with other people from other counties using the same budget that they've been given, increasing their net expenditure on healthcare, yet they're taking care of other people. The second group are those people who used to come to Kisii Level 5 Hospital, but now Kisii has been taken away from them as a county, and they're left without any meaningful facility, and they have to start developing a health facility from scratch. So what should we do? We should have something called equalization, where we ensure that each and every county has a hospital that has sufficient infrastructure and sufficient number of health workers to meet, at least to some degree, the services required in that area. And this is not a new concept either. We already defined such a hospital in the Musimi Task Force report last year in January. And we said, put this kind of a hospital with 6 theaters, with an ICU with 20 beds, and put 10 dialysis beds in each and every county, and put this MRI, CT scan, and this laboratory panel. This is a report we made sometime last year.
That sounds a little lofty for people who would be saying, okay, that sounds very ambitious.
Well, it is not ambitious, because if you look at Mama Lucy Hospital, for example, and it cost 500 million to build and equip from ground up. It has a CT scan, it has an ultrasound machine, it's a beautiful building, and that's a big part of the cost. That cost 500 million. If you were to put, and the estimate from the Musimi Task Force report was to put 1 billion shillings per county, not at once, but about 18 billion for the first year, another 18 billion for the second year, and 18 billion for the third year. That's the cost of one southern bypass every year. We will achieve that for each and every county for the next 3 years. It's not utopian, it's actually reasonable.
And now with all of that funding that you're talking about, the 247 billion that would be required to upgrade hospitals in every county, that figure versus 210 million that's going to the counties will be shared out.
Absolutely.
And will not just cater to health services, but will cater to other services as well. You know, water, garbage collection, you know, roads, and all of those other services that are required by the county. Do you then think that some of your recommendations, well, it's obvious they were not factored in to this allocation.
Yes.
What are your thoughts then on that 210 billion that's going to the counties?
In fact, the 210 billion going to the counties, 35 billion is health worker salaries. 35 billion. What does that tell you? About 1 billion should be allocated in every county in their budgets just to pay health workers alone, if they're going to use the money for salaries to pay salaries.
Okay.
But as you'll see, some counties have given 100 million, meaning that the issue of paying health workers has not featured anywhere. So already the funding to the counties is very inadequate, and they have other issues to take care of. They have the other devolved functions, water, for example, and they have to maintain some degree of security in their own regions, and they have to pay their own local workers. So the structure that is required in the evolution of healthcare, it's quite intense. It's not this business of waking up one morning and saying, let's devolve healthcare in a week, we're going to have teething problems. We take the example of Spain, for example. Spain is a developed country. They have good infrastructure. Each and every region has a hospital that has better facilities than what we were envisioning in our Musimi report. Yet Spain took 15 years to devolve healthcare in only 7 regions. 15 years. How is it that we cannot learn from those who have gone down the path, and we want to decide we're going to devolve immediately, just like that? And even as you do this, we don't even consult the people who work in the sector. I have a passion for improving healthcare. As a union, we have done a lot of work and made a lot of recommendations. How is it then that you go ahead and decide that this union people don't know what they're talking about? Let us just go ahead and devolve anyway.
So have you not been consulted in any of this?
Absolutely not. I spoke to one of the commissioners of Transitional Authority, the gentleman in charge of healthcare particularly, and he told me, we consulted you through a group called APSEA. I asked him, what is that? He tells me this is a group of professional associations that cover everybody in East and Central Africa. You know, I know for a fact my union does not belong to that group. Neither does the nurses union, neither does the clinical officers union. And I think that was a bit, I think in a way that was a bit arrogant, and I felt perhaps there's a scheme to circumvent the requirement to consult by consulting some ambiguous entity that's supposed to represent everybody who's a professional in East and Central Africa. We are not part of that group, and we have not given our input to the devolution process. If we had, we'd have a very smooth process and we'd have a very successful process.
Okay, all right. Speaking with Dr. Victor Ngani, who's the chair of the KMPDU, that's the Kenya Medical Practitioners and Dentists Union, and we are talking about devolution of health services and why they're unhappy at not having received their salaries for July to date and their concerns about just where their money will come from. Keep your views coming in. We want to take a short break, but we carry on with this discussion after that break. We're talking about that. What they're saying is not a doctor's strike, but all doctors will be in Nairobi next week to try and ask, hey, where's our money? So all of that next. If you have any views, please do keep them coming in on Twitter and on SMS. Short break. We'll be right back.